Gentlemen, another one on the series of sexual health in men. All right. I have constantly warned you against masturbation and also vigorous sex, having sex for pressure and not for pleasure. All right. I've also warned you against women who are so ratchetry that they want to exercise all they have seen in porn on you. I've also warned you against yourself. You go and watch porn and now you want to exercise what has happened in porn videos on women. It's going to mess you up, right? Because there's something called penile fracture. Have you ever heard about that? That your penis can actually break? We put that in quotes. Remember this. This is not a fracture like the one that happens in bones, but I'll explain it in very, very easy terms so that you can actually understand it. Now, listen. Your penis, on top of the penis, so we have a penis, then inside, on the upper part, we have two cylinders that are very rich in blood vessels. These cylinders are called the corpora cavernosa, right? They are rich in blood vessels, and this is where blood flows into. They gorge with the blood, and when you retain blood there, you have now firm erections for a prolonged period of time. It's called what? Corpora cavernosa. Gorges with blood every time you have an erection. Number two, we have another one that coats these two cylinders. There's a thick layer, fibrous layer that coats these two cylinders. And that fibrous layer is called the tunica albuginea. Tunica albuginea. Now, this tunica albuginea, remember, is a tough fibrous one. And when you're having erections, it tends to expand. And when it's expanding, it becomes thinner, right? So it's actually exposed to tension. Now, if there is folding of that penis forcefully or involuntarily, that tunica albuginea can actually rupture. When it ruptures, there will be a cracking sound as though something broke. This is what we call penile fracture. It is very painful. You will experience a lot of pain, sharp pain at that moment in time, very painful erections, and sometimes this fracture can be very dangerous. It extends all the way to the urethra. Now you can actually have painful urination and even blood in urine, and also a risk of infections. All right. So what breaks is not like the penis is a bone as such. No, it's because of the tunica albuginea that actually ruptures. So when a penis is flaccid, it can actually be folded in different directions. Why? Because there is no tension exerted on the tunica albuginea. Now it can actually fold. Okay, the fibrous tissue is not tensed. But when you have the tension because of elasticity, because of expanding, the tunica becomes very thin and very fragile. And it actually rupture, causing this fracture. So that is how it happens. Now, most times when you're having vigorous sex, sometimes when you get the erections, morning erections, and then you roll on the bed, you can actually cause yourself this problem, or even a fall. Sometimes when you're hit by a hard substance, somebody can kick you when you are erect. And those people who are actually abducted, they can actually experience this, right? So all these can actually, and masturbation, vigorous masturbation. You're constantly masturbating vigorously, and you realize the more you masturbate, the more your penis loses the sensitivity. Even people who use those medications to numb the penis so that they can actually have at least a prolonged time before ejaculating, those who have a premature ejaculation, they use the lidocaine gels to apply on the penis to numb it so that they don't get the sensation faster. They end up getting this because, and even those who are using drugs to enhance erections, you can end up having a lot of, we call it priapism, painful and very prolonged erections that can actually exert a lot of tension on the tunica albuginea. Now it ends up rupturing. When it ruptures, you have now a fracture. Now your penis is bending. It's not like it's a curve, no, it's a bend because you actually ruptured the fibrous tissue that is supposed to actually give you these firm erections. Right? So this tunica albuginea is the one that maintains a firm penis during erections. And then when you're using all these medications, you're actually exposing it to a lot of tension. It ruptures, causes you a lot of problems. And it's very, very, you can actually recover from it. But it's an emergency surgery. So a surgery that is done within the first 24 hours can actually bring you back to recovery. But if you delay, that means you might end up having permanent damage. You might end up having a curved or a bent penis, which will give you very, very painful erections in future. So we need to actually fix that. So please stay away from masturbation. Please stay away from vigorous sex, and everything you see in porn is not sex. It's for entertainment purposes, and those people are enhanced on medication. Please do not even follow what you see in porn, right? Because complications can actually be a serious problem. It can actually be a permanent curvature. We can also have painful erections in future. You can have scarring, erectile dysfunction can actually come in, and of course, injured urethra, which brings you a lot of infections, a lot of pain during urination and all that. All right, so avoid those things. Treatment is surgical, as we said. That's the first priority. But those of you who prefer using ice, who prefer just massaging and using some medication to actually clear the pain, basically the anti-inflammatory medication to kill the pain, realize you need that tunica albuginea to actually be repaired. All right. So yes, seek medical advice. Basically, drop the porn. Communicate during sex, because some of you will lay down and allow a woman to do what she has to do. There are women who are actually learning the skill of riding, and there are women who are actually very vigorous in terms of that riding. There are men who want to actually make sure that the woman gets a squatting orgasm, and now you're basically pounding for pressure and pressure and pressure because you want the validation. As you do that, problems, you end up folding the penis by mistake, and pop, you hear the cracking sound, and now you are in pain. Now you have a problem with the fracture. All right, so do not do those things. And also, I also understand there are cultures that actually tell men either to masturbate so that they can actually curb uh, the issues with the sexual desire, or there are people who actually tell them to actually fold their penis so that when they get some pain, that sense of erection disappears, that feeling of a desire of sex disappears. So there are cultures that actually do that, and this video is not intended to actually destroy any culture or talk against any culture, but however, you can find other means of distracting yourself from the sexual desire. For example, we know that for you to get an erection, you must flow blood into the penis. So you can simply uh, redirect this blood into something else. For example, if you go to the gym when your testosterone are going up, or when you're having these erections, you will train, and that desire will disappear. Right? When you distract yourself, go and read a book, a masculine book, all these desires disappear. So penile erection is actually penile fracture is actually a serious condition, and it needs surgical care. Right? Don't be shy to ask for help. Don't be shy to go to the doctor, because again, you can imagine a man going to the doctor with a fractured penis after having sex with a woman, or even another man, because nowadays it's very obvious. And you can imagine now you're being taken to hospital with a penile fracture. The shame that is coming with that actually makes most men simply use ice packs or painkillers and stay at home. But it's not bad to seek help. When you're in such condition, just know it's a condition that can actually happen. It's rare, but it can actually happen if you get involved in the activities that I just mentioned. So don't be afraid to seek for medical help. Right? Yeah.